everyone, and thank you for joining my session called Pets for Life, Increasing Equity and Access to Care Pet Resources. I'm excited to share this information with you today as we have a crucial and in-depth conversation about access to care in animal welfare. Today, I'd like to share why programs like Pets for Life are needed and why there are inequities in access to pet resources. The why is so important for our field so that we have context of and can create the most effective responses and solutions. We have to have important conversations about poverty and understanding the impact it has on our own communities. Over the last few decades, animal welfare has made some huge strides for animals. We still have many challenges in the field, but we've made progress in changing the way we approach and talk about the most vulnerable communities and their pets. Historically, we have brought animals into a very sharp focus, such as the dog that you see here, or a cat, are typically seen very clearly without much thought beyond that as a whole. What we've just recently begun to do and must prioritize in our movement is bringing the entire picture into focus, as you can see here. That doesn't mean making the animal less seen or pushed in the background. It doesn't mean that animals are less important. It just means that we need to grow awareness of the person the animal is connected to, the environment in which the animal exists, and the community that the animal is a part of. When we have greater clarity of the entire picture, we are much more effective in our work. Now, the next few slides will show data from the United States that give important information when discussing poverty and understanding communities. The overall data around income and wealth are important to understand. We must also look at these issues and how they are experienced based on race and ethnicity. The two are inextricably linked. More than any other demographic category, race is the predominant indicator of outcomes in all areas. Areas such as human health, education, housing, and criminal justice are just a few where race is that predominant indicator of outcomes. Additionally, a much higher percentage of Native, Black, and Latino people experience poverty. Now, based on the prior information that I just laid out, we must discuss and understand the layers of inequities that exist in every facet of our society. And on a deeper level, understanding how those inequities impact people and therefore their pets. Unfortunately, poverty is pervasive in the United States, and data from the US Census and the United Way shows that 42% of the population is either living below the poverty line or what is called ALICE. And ALICE is an acronym that stands for Asset Limited, Income Constrained, and Employed. And it is a measure that defines households earning just above the federal poverty level, but not enough to afford a basic household budget in their community, meaning that these households struggle to afford essentials like housing, food, childcare, and transportation. This impacts an estimated 140 million people here in the United States. And of course, living with people who are experiencing poverty are at least 20 million pets, with tens of millions more hovering just above. This is where reminding ourselves to focus on the pet and their family is important to understanding the access to care issues in the most vulnerable communities. And the same is true with wealth. There is a significant racial wealth gap that is continuing to grow due to the cumulative effect of historical policies and intergenerational wealth transfers. You can see that the median household wealth here for white, Black, and Latino households. Native American wealth is not consistently collected or reported by the United States government, which can really make it difficult to track. But most estimates are less than $10,000 of median wealth for Indigenous households. Economists estimate that 80% of lifetime wealth accumulation depends on where a person starts and intergenerational transfers. What that means is that opportunity is literally passed down from generation to generation, and the current wealth gap is generations in the making. As I mentioned earlier, wealth determines a wide array of life outcomes: where someone lives, what someone might have access to, and if someone is a renter or homeowner, and so much more. And poverty in Australia affects a significant portion of the population as well, with over 3 million people living below the poverty line, including many children in Indigenous communities. While Australia has a high standard of living overall, income inequality and rising housing costs contribute to persistent economic hardship for the most vulnerable groups. And with that statistic, that means about 1 in 8 Australians, or about 13% of the population, 31% of Aboriginal and Torres Strait Islander people, and 56% of those experiencing poverty are renters. Now, this map here shows how the United States has no adequate supply of affordable rental housing for the lowest income renters. What we can see here, that when home ownership is made difficult or impossible, then renting is really the only option left. This creates several challenges and shows how extreme these challenges can be. This map shows how there is not a single state in the country that has a sufficient supply of affordable and available housing for low-income families that are looking to rent. The numbers represent how many rental homes there are for every 100 low-income families. And this, of course, does not take into account pet-friendly affordable housing. And we do know, even if there may be affordable pet-friendly housing, it often can come with restrictions and policies that can be nearly impossible to uphold as a low-income renter. Historically, the United States faced such a housing crisis because of policies created decades ago that still has an immense impact on families today. The New Deal was a policy that President Roosevelt created in the 1930s, but many programs under the New Deal were deeply unfair to Black Americans. The Homeowners Loan Corporation, or HOLC, and later the Federal Housing Administration, or FHA, introduced mortgage programs that made it easier for white families to buy homes, and these programs used redlining. Redlining meant that neighborhoods with large Black populations were marked as too risky or high risk for loans, so Black families were often denied mortgages or charged higher rates. And in turn, this blocked many Black homeowners from building wealth through property ownership, while white families gained access to low-interest loans and long-term housing stability. The disproportionate effects of these policies created a racial wealth gap that still exists today. This is an important context when considering housing insecurity is a top reason pets are surrendered to shelters. Housing affordability in Australia has significantly deteriorated over the past decade, with rent increases far outpacing wage growth. We see that over 1.26 million low-income households were in financial housing stress in 2024 to current day 2025, spending more than 30% of their income on housing. And over the past 10 years to March 2025, median advertised rents in Australia rose by approximately 48% for both houses and units, outpacing income growth. These figures highlight a growing inequality in access to secure, affordable housing, especially among the vulnerable populations. When it comes to veterinary care in the United States, the over 20 million pets that live in households experiencing poverty do not have accessible or affordable veterinary care. This means that lack of access disproportionately affects marginalized communities, where basic services such as vaccinations, spay-neuter, and other wellness services are often out of reach. We are also seeing that access to affordable veterinary care is increasingly limited. Since 2019, the cost of vet services has risen by 42%. and a projected shortage of up to 24,000 companion animal veterinarians by 2030 threatens to worsen that gap. This growing disparity puts both animal welfare and the well-being of low-income families at risk. And similarly to the United States, we see that PetSure reports in Australia a 34% increase in veterinary costs since 2020, a rise that far outpaces general inflation, placing an additional financial strain on pet owners. At the same time, the shortage of veterinary professionals is not a distant concern, but an ongoing challenge, with the AVA, or Australian Veterinary Association, highlighting the current shortage as a critical issue. This combination of rising costs and workforce gaps is intensifying barriers to pet care, particularly for low-income families, and could worsen overall well-being of companion animals across the country. I'd like to talk briefly a bit more about Pets for Life and the program's core philosophy and the impact that we have made. By taking all of the information shared into account, we can see programs that address access to care issues are absolutely necessary. Now, Pets for Life started about 14 years ago to work towards increasing equity and access to pet care resources for people experiencing poverty or living in underserved communities. Through door-to-door community outreach and facilitating pet support services, Pets for Life provides veterinary care, basic supplies, and information at no cost to people and their pets. The program strives to build trust, positive relationships, and long-term community partnerships. And this is all with a goal of making companion animal welfare more community-based. And what you see here is a map of all the communities that has implemented the Pets for Life program. It's currently in over 60 communities across the country, with many more organizations not listed that have adopted philosophies in line with the access to care work. We have our core Humane World for Animals staffed programs in Los Angeles, California, and Philadelphia, Pennsylvania, which you can see here with the larger brown dots on the screen. And outside of the Los Angeles and Philadelphia markets, the work is carried out by various types of local groups, represented by the light blue and the green dots on your screen. Some of these groups are open admission or municipal shelters. They're limited admission or private shelters, non-sheltering animal welfare groups like a spay-neuter or community medicine clinic, and several native-led agencies. Additionally, the program has impacted urban, suburban, rural, and Native Nations communities. With the Pets for Life structure, we approach our work in three main areas. They're all individually important, but they overlap to tackle access to care from both a micro and a macro level. One is our direct care programming, which is carried out in Los Angeles and in Philadelphia. In these two markets with our Humane World staff, they operate the community outreach model that builds trust, relationships, community partnerships, and meets people exactly where they are. We provide spay-neuter, veterinary care, pet supplies such as crates, leashes, collars, litter boxes, and other services like pet fees and behavior training, all at no cost to the pet owner. The third area of focus may seem more nebulous, but it's a really impactful part of our work. Through research partnerships, data collection, and creation of industry tools, we provide resources on how to make our movement more just and inclusive. Now, in order to begin implementing access to care work, you must first understand the makeup of your own community. Creating a community assessment provides a more comprehensive examination of your community with an overview of the economic and spatial inequity that exists there. Statistics that showcase the challenges people face in accessing resources for their pets are important to share with your organization and with the general public. A community assessment also pinpoints a focus area, so that you can develop a disciplined outreach strategy that is rooted in relationship building. Having limited resources requires you to focus geographically, allowing saturation and then migration of the work. Now you can see here, after doing a community assessment for Philadelphia in Pennsylvania, we were able to outline the area of focus where we see the most underserved pets and people. And you can see that with the dark gray area. This is where services for the program are provided and the door-to-door community outreach takes place. In the United States, this would encompass zip codes for each section of that dark gray area or different neighborhoods. Important things to observe here would be the barriers to accessible pet services, with most veterinarians located outside of the focus area or not having accessible and affordable care. And the same goes for pet supply stores and local organizations. And it is important to note here that to scale, you can see there may be some dots that are located within our focus area, but that does not take into account the transportation barriers that may be giving a community additional hurdles to get over to access pet care. A model based on building long-lasting trusted relationships can be measured by collecting data over time to show the impact of this work. Heat or density maps like the one here, and again, this is Philadelphia, over the last 13 years, this is showing the location of new people and pets met each year and how we start focused, expand over time while still maintaining a presence where we started. It is possible to grow while never leaving the areas where the program has been. You see here how the program grows over time while maintaining areas served. And these are all high-quality relationships that have provided consistent support for pet owners in Philadelphia. Beyond understanding your community on a deeper level, you will need to organize and strategize based off of what your program wants to accomplish with access to care work. From there, with methodical implementation, you will be able to work through barriers and create accessible services to pet owners living in poverty. Since the program began in 2011, we have provided services to over 360,000 pets. We try hard every day to be a comprehensive support system and always offer resources like spay-neuter, veterinary care, but it also goes way beyond that. By listening to what people want and need for their pets, we'll also include things like supplies, grooming, pet deposits, etc. We know that through looking at cost comparisons with some of our Pets for Life partners, that keeping a pet with its loving family through basic services and support is much more cost effective than intake of these pets into the shelter system. Considerations of length of stay, staffing for the care of these animals, feeding, basic medical needs, and more can all take a toll financially on an organization. So what does lack of access mean for a pet owner? In every community where Pets for Life has programs, we've collected the exact same data. It's given a strong snapshot of how inequities impact people and their pets. Of all the pets served through Pets for Life, at the time of meeting, 85% were unaltered, and almost 70% of pets have never seen a veterinarian before. This is not an indicator of lack of interest, it's an indicator of lack of access. Financial barriers, transportation barriers, and lack of available information are all contributing factors. 82% of pet owners report that they have never reached out to their local animal shelter or animal services agency. Of those who may have, we know that many of those interactions could have been negative and left a pet owner with fear for reaching out for support, although their local organization should be a trusted place for any pet owner. This highlights the severe engagement gap that exists and where we have an opportunity. We have too much information now to just dismiss our role. We see that human issues are animal issues, and inequity is our duty and obligation to contend with. And that brings us to this multi-level access to care model, which you've all probably noticed is becoming a much bigger part of the conversation and standard practice in our field. The access to care response employs a full spectrum approach that works to break down all of the barriers. Our work ensures resources are available, attainable, affordable, appropriate, and accepted for people and pets. So, while cost is a major barrier, we need to do more than provide financial assistance and subsidize services. Even if the cost of services is addressed, often the location of service providers and transportation to and from services is a challenge. Then, even when costs and transportation are addressed, the services offered must be determined by taking guidance from the community, not going in with an agenda. This requires positive community engagement and trust building. All 5 of the considerations must be part of the program operations. So, in a quick summary, here are some keys to success. Get up close and personal. Don't be afraid to make those connections. Recognize the difference between just offering services and creating equity and access. Remember the access to care model. Cultivate a long-term, consistent presence in the community, and the goal is to make long-term sustainable programs. Listen to and respect the community's perspective. Remember that people are experts in their own lived experience. Identify and remove barriers to services whenever possible. Build community partnerships and coalitions outside of animal welfare. And always extend compassion and understanding to people. I thank you for joining me today in this ongoing important conversation of access to care and animal welfare. Please feel free to contact me with any questions you may have with my email address provided on the next slide. Thanks and take care.